Hi everyone, this is Dr. RAZA. A small video on COVID third wave and children. As there are many questions in everybody's minds that why they are predicting that third wave is going to come and why it's going to affect children more. There are two reasons. Like if you see the COVID and the presentation, in the first wave in 2020, we saw elderly people with morbidities like diabetes, hypertension and malignancies getting affected. In the second wave, we saw the age group changing to more people getting affected between 30 to 45 years of age. So the reason was, the first wave, those people, elderly and those who had partially or completely got vaccinated with COVID vaccine escaped in the second wave. And this younger population between the age group of 30 to 45 were mingling each other, and there were a lot of lacunae in the precautions with COVID, like people were not following social distancing. We used to see people without masks. For these reasons, they got affected. And once you get affected with any disease, there is some sort of an antibodies getting developed in the body. These antibodies give protection maybe for 2 to 3 months for those patients. And sometimes people who are staying along with these COVID patients have also got some antibodies developed without getting a disease. So for this reason, everybody feels that the second wave and the first wave affected the population above 30 years, and the next population, which is not vaccinated and which may get affected, is the age group of 0 to 18 years. So, but one good thing with children is that they have less number of ACE receptors where a COVID virus can get attached to. So with all these in the background, since we have a prediction that children may get affected, everybody are little worried about it. So the IAP had come out with a statement that if children get affected with COVID, 80 to 85% of the children will have asymptomatic disease or a disease with a mild COVID infection, which can usually be treated by a pediatrician or a family physician by making the child stay at home. Another 10 to 15% of the children may develop a moderate disease, which is progressing from a mild disease. It cannot come suddenly. Once they develop a moderate disease, these children may require hospitalization and management only for the sake of monitoring, so that they do not progress into a severe disease. And according to the prediction, 1 to 3% of the children may get affected by COVID in a severe form. Normally in children, these infections usually affect all parts of the body, and we pediatricians are worried about the inflammation or the infection of the heart, where the consequences are very, very bad. With regard to this, what are the precautions and to be followed before a third wave? First precaution is, there is no substitute for social distancing. So in the month of August to November, Indians have a lot of festivals, so there is a possibility that there is a mixing of people. So avoid as much as possible social gatherings and more number of people mixing without a social distance. And there is no substitute for a mask. Maybe double masking is preferable. And no substitute for hand washing and sanitization through sanitizers. These three things have to be strictly followed for some number of years to prevent COVID infection. The other things, try to see to that as many number of people get vaccinated with COVID vaccine, whichever is available in your area. Number third, Many children, what we see, have been lagging behind in the routine vaccinations. So we pediatricians would advise them, these children, to get vaccinated with whatever vaccines they are due for. The fourth important thing is, see, treating of a children is a partnership between the parents, the doctors and the healthcare providers. So the most important thing to prevent COVID wave or to have a warning sign is to educate the parents. Parents to be educated for like basic things, to record the temperature of the child, to see the pulse, to see the respiratory rate, and also the use of pulse oximeters. If these things are monitored at home, the parent can decide when the child is going to suffer from moderate to severe disease. So our advice is, parents at home, try to learn some basic things so that you can detect some danger signs at home and the child can be provided early treatment in a hospital. The fourth thing, most important, is some of our doctors are used to treating adult patients. So in the COVID group also, like between the age group of 0 to 3 years, difficult to manage alone. So a parent should be there to supervise the child and stay with the child. The parent should take all precautions to wear an N95 mask and use of gloves, sanitizers as much as possible. The second age group here is you have partial supervision, the age group between 4 and 11 years, where sometimes the child can be supervised, sometimes the child can be left alone and taught of things how to be isolated from others. And the adolescents between 12 and 18, they can as much as possible stay alone and manage themselves. So this group, the one which is, and one more important thing is, children at a lower age group are more, the disease is more progressive very fast. So for this reason, we have to keep a watch on the baby. So parents should be advised about taking care of these children. And secondly, doctors and nurses who are used to managing adult patients have to be trained to take care of these children. So only we are worried only about the moderate to severe disease when they are progressing, so that early detection and early management may be the key for management of these severe cases.